How much does an awake craniotomy cost? Imagine having a brain surgery where you're awake and alert, helping your doctors remove a tumor while they watch your speech and movement. That's what an awake craniotomy is. Now, you might wonder, how much does this specialized procedure cost? The answer varies quite a bit depending on where you are and your specific needs. Generally, the total cost for an awake craniotomy ranges from about $35,000 to over $80,000. In some hospitals, the average cost for surgeries under sedation, which includes awake procedures, is around $52,000. The range can go from roughly $35,000 to $82,000 depending on the hospital and the complexity of the case. It's important to note that these figures include many factors like preoperative imaging, anesthesia, surgical time, hospital stay, and postoperative care. The cost is influenced by several things. Pre-surgery planning and detailed brain imaging are essential and add to the cost. The anesthesia used in awake craniotomies is specialized, involving nerve blocks and sedation protocols that differ from traditional surgeries. The length of your hospital stay, especially if you need intensive care, also impacts the total expense. Longer surgeries or complications can increase costs further. After surgery, rehabilitation and follow-up care are necessary, which can add to the overall expense. Some studies suggest that despite the high upfront costs, awake craniotomy can be cost-effective in the long run. This is because it often results in better tumor removal and fewer neurological deficits, which can reduce long-term healthcare costs. By preserving critical brain functions, patients may experience a better quality of life and fewer complications, which is a vital consideration in treatment planning. Since costs can vary widely depending on the hospital, geographic location, and individual health factors, it's best to talk directly with your healthcare provider and insurance company. They can give you a more precise estimate based on your specific situation. Remember, while cost is an important factor, the primary goal is always safety and the best possible outcome for your health. Always consult with your medical team to understand the options and what's best for you.